Following your oral surgery procedure, you will experience some bleeding, which is perfectly normal. We will have sent home some gauze with you in your patient take-home bag that you'll use every 20 to 30 minutes to change out until the bleeding stops enough that you feel good about just leaving the gauze out completely. If you're experiencing excessive bleeding, especially after the first couple of hours, just remember that you do need to bite down on that gauze firmly because it is a pressure dressing. If you've used all of your gauze, feel free to get a tea bag out of the cabinet, moisten that tea bag, squeeze all of the tea bag, and bite down firmly on the tea bag. After you've tried that, if you're still experiencing a good amount of bleeding, feel free to give us a call, ask us our opinion, or maybe you just need to be seen back in the office. After your oral surgery procedure, we want you to avoid rinsing, swishing, spitting, and using a straw for the first 24 hours. Along with this, we also want you to avoid using toothpaste for the first 24 hours. We will provide a soft toothbrush for you so that you don't irritate the soft tissue or around the surgical sites. In some cases, we will prescribe an antiseptic mouth rinse that we will want you to use after your oral surgery procedure. We don't want you to start that rinse until 24 hours after the procedure. You use it twice a day, just like any other normal mouth rinse, morning and night after you eat, whichever's easiest for you. If you're not provided an antiseptic mouth rinse, you are more than welcome to use saltwater rinses to help soothe those areas, but we want you to wait 24 hours to use that as well. After the procedure, if you want to eat and drink, that's perfectly fine. If you're going to have a milkshake, make sure you use a spoon. Again, we want you to avoid that straw for 24 hours. I definitely recommend staying with the softer foods, stuff that you can kind of cut with the side of your fork, stuff that's easier to chew, nothing too crunchy, chewy, anything like that. You don't want to upset those surgical sites. Chew towards the front of your mouth and definitely try to avoid those surgical sites as much as possible with that food. If you are given a syringe after your oral surgery procedure, we definitely want you to wait 5 days before using that syringe. Once you're able to use it, you're going to want to fill it with warm water or warm salt water to help irrigate that area to keep any food or debris from getting trapped down in the socket. Rinsing before the 5 days is up can delay your healing. Unless you've had any form of sedation, most patients can return to normal activity in anywhere from 1 to 3 days. If you have had any sedation, just remember that the person that brought you to the appointment will also have to take you home. It's best to just go home and rest, and to remember that you cannot operate a car for 24 hours. Depending on your surgical procedure that you have done, we may give you a mild and a strong pain medication, but definitely remember if you're needing to take that stronger pain medication, you do not want to operate a motor vehicle for 24 hours following taking that medicine. Following your third molar procedure, you will experience some swelling. We will send you home with a head wrap that's got ice already in it, which is refreezable. You're going to want to use the ice as much as you can the first 24 hours. 20 minutes on, 20 minutes off is typically what we advise for our patients. Also, to help reduce the risk of swelling, you're going to want to keep your head elevated. If you can sit in a reclined position, that helps best to stop the bleeding and the swelling. Swelling peaks at 72 hours. After the first 24 hours, heat works very well to help reduce the swelling. Occasionally, a patient will experience a bony fragment trying to work its way to the surface. It can be totally normal. It is not the roots of your teeth working up. They usually will work themselves out in a couple of days. If they're not and you feel like you need to be seen, call our office and we'll get you in to see if we can remove those for you. Most oral surgery procedures do require some sutures. The sutures normally dissolve on their own in 7 to 10 days. If they're causing you any discomfort or if you need to have them taken out at our office, we will schedule an appointment to do so for you. If you're a smoker, please listen carefully. Smoking is the #1 cause for post-operative issues, including delayed healing. If you are a smoker, we want you to avoid smoking for a minimum of 5 days. Smoking will cause more problems, including more pain, delayed healing, and damage to the wound itself. If you're experiencing anything that you have any concern with, please feel free to call our office. If you need us after hours, there is a number provided, and you'll call that number and wait for instructions from our answering service. Along with that, prescription refills can only be given during our regular office hours. Some of the prescriptions you will have to come to the office to pick up. Others can be called into your pharmacy.